1970 when I came here with Dr. Richard S. Green. We had come out of the military. Dr. Green had been the dermatologist for Fort Leonard Wood in Missouri, and I was the dermatologist for the Pentagon in Washington, D.C. We came here, we began practice.
Skin and Cancer Associates is one of the largest and most prestigious dermatology practices in South Florida. The board-certified and fellowship-trained dermatologists and dermatologic surgeons at Skin and Cancer Associates specialize in all aspects of dermatologic care and surgery. Cosmetic dermatology is a large part of the practice. Cosmetic procedures are offered through the practice's Centers for Cosmetic Enhancement, located in the Plantation, Hallandale, and Aventura offices. Skin and Cancer Associates has offered its patients the latest and best dermatologic treatments available for over 20 years. Considered the local experts on all aspects of dermatology, from skin cancer to cutting-edge cosmetic treatments, skin care and laser surgery, our doctors are frequently asked their expert opinions on dermatology and related subjects.
Before my liposuction sculpturing by Dr. Daniel Wolf, I dieted and exercised but couldn't attain my goal of slim, smooth thighs. As much as I wanted Dr. Wolf to do the procedure, I was nervous because I'm a chicken at any doctor's office. Thanks to his calm manner and precise step-by-step procedure, it was an easy in-office procedure, and I would gladly do it again if necessary.
If you want to get rid of any hair on your body, bikini line or wherever, this is a good procedure to get done. It's very minimal pain, there's no scarring, there's no ingrown hairs from the electrolysis.
Coming up, learn more about cosmetic laser procedures, liposuction, spider vein removal, hair transplants, and the other in-office procedures offered at the Centers for Cosmetic Enhancement. The physicians at Skin and Cancer Associates Centers for Cosmetic Enhancement were some of the first physicians in the nation to offer hair transplantation and have performed over 7,000 hair transplant procedures.
As you know, hair transplants go back a long way. Dr. Norman Orenreich pioneered the first transplants well over 30 years ago. And at that time, they were done from individual punches or plugs, which were removed from the back of the scalp and placed into the front or balding areas of the scalp. And people used to say, why would they grow when they're taken from the back and moved to the front? The hair was lost in the front, and actually, it's not a hair transplant, it's a scalp transplant. These are full-thickness grafts removed from the posterior donor areas, and those grafts are placed in the frontal areas, take the characteristics from the area from whence it came. So this hair, which is destined to live a lifetime, when it's moved into the balding areas, will grow and grow.
The physicians at the Center for Cosmetic Enhancement have been performing hair transplants for over 25 years and are considered the best in the field. They utilize the different transplant procedures, micro, mini, and laser hair transplants, to treat different balding patterns.
Al is only 22 and started losing his hair 3 years ago.
Well, it just started to thin out a little bit, and, you get the jokes and everything. Everybody.
Embarrassed, Al started checking into hair transplants and found a new, improved technique using a laser. He had 2 procedures and needs more, but so far, he's happy with the results.
I think mine looks the most natural out of anyone else's I've seen.
And it's wonderful technology for the doctor and for the patient.
That's because the laser makes tiny incisions on the scalp instead of larger, round holes. Plus, there are other benefits.
No bleeding, no bandage, very fast recuperative time. The little scabs, I say, are gone in anywhere from 12 to 14 days.
Mitch had a hair transplant 5 years ago using the traditional plug method. Now he's having the laser technique to get rid of the plug look.
You're able to really do nice, minute filling going in between those existing hairs without injuring previous work.
2 hours later, Mitch is finished with his first round. He had 200 plugs and was surprised how little pain there was.
It's 20 times easier than what I had done 5 years ago.
The Centers for Cosmetic Enhancement are at the forefront of cosmetic laser technology and are involved in the study and use of cosmetic lasers. Laser resurfacing and rejuvenation procedures are available in all 3 Centers for Cosmetic Enhancement. Many people choose this non-invasive technique over facelifts and traditional surgeries to revitalize the skin's appearance and smooth fine lines and wrinkles. Our physicians are among the best in these techniques. Since 1974, they've taken the lead to offer South Floridians the finest and most advanced knowledge and technology in all aspects of dermatologic care.
Daily Life begins tonight with the hottest thing going, literally, to make wrinkles disappear. 7 Health specialist Marilyn Mitchell with a look at laser resurfacing in tonight's HealthCast.
Just to look better, to feel better. When you look better, you feel better, and look younger.
Barbara Molina wants to get rid of the fine lines on her face and even out her skin tone. But instead of undergoing standard laser surgery, in which her face will remain red anywhere from 3 to 6 months or longer, Barbara chose what's called the Feather Touch laser. Aventura dermatologist Dr. Mark Nestor is doing the procedure.
These patients didn't want to necessarily have the deeper laser treatments, and yet they still wanted to have something for their fine lines.
The Feather Touch laser gets rid of fine lines but does much less damage to the skin. That means the healing time is quicker, but the results are still good.
The pinkness goes away very quickly. We've seen it as quick as 2 weeks in patients, and we've seen other patients 3, 4 weeks, but it's a very mild pinkness. And this allows patients who don't necessarily have the time and who also want the procedure done, who don't have the deeper problems and wrinkles, to have the benefits without having the downsides. It's just vaporizing a very, very thin layer of skin. And it's just this white dust that remains, which we'll just take off.
The redness will be gone in a matter of weeks, and so will the fine lines on Barbara's face.
The doctors at Skin and Cancer Associates are experts in treating all manner of dermatologic conditions.
Hello, I'm Faith Daniels, and this is Today's Health. You know, we're all vulnerable to both mental and physical diseases, but we're not defenseless. Today we'll explore some ways we can fight back to prevent, control, and cure the serious threats to our health.
Acne, or acne vulgaris, and acne rosacea are 2 very common skin conditions. Basically, both are associated with the redness of the face, pimples, pustules. However, with rosacea, which is often called adult acne, the major feature is dilated blood vessels.
In advanced stages, the nose may become red, bumpy, and permanently swollen from excess tissue. Acne and rosacea may sometimes look similar, but they are different conditions and are treated with different medications.
Neither acne nor rosacea are life-threatening illnesses. Both rosacea and acne have a physical impact and emotional impact as well.
If you think that you may have rosacea, it's a good idea to see a dermatologist. Untreated, the condition can get worse and become more apparent. No one wants to deal with a facial condition like acne or rosacea, but these disorders don't have to affect your life or self-image. Innovative skin treatments can help keep these conditions under control so that you can always put your best face forward.
Each Skin and Cancer Associates office includes a dermatology depot, an in-house pharmacy where patients can buy many medications and the best in skincare products, including cleansers, toners, sunblocks, and anti-aging products that combine alpha hydroxy acids with a special blend of vitamin C-based antioxidants.